Korsakoff's disease is a condition characterized by an impairment of memory retention and formation as a chronic outcome of a thiamine deficiency. Sergei Korsakoff, in 1887, underwent a study where he found that subjects presented had their short-term memory disturbed, and some even had long-term memories affected. While Korsakoff highlighted the effects this disease had and concluded a possible link to alcohol consumption, he did not have a definitive answer. The decade following saw subsequent studies denote that the mental disorder had other causing factors, not just alcohol consumption. In the late 1900s, the idea that Korsakoff syndrome may instead be related to a deficiency of thiamine became more widely accepted, and that it was excessive alcohol consumption that could lead to a thiamine deficiency. The worldwide prevalence of Korsakoff's disease is thought to be between 0 and 2%. In 1989, a study was conducted in Australia, and in people over 15 years old, the prevalence of Korsakoff's disease was 2.1%. Due to this study being over 30 years old, its validity in today's landscape can be questioned. However, because Korsakoff's disease is mostly underdiagnosed and there is disagreement regarding precise diagnostic criteria, there is little data on the incidence and prevalence. Although these estimations can be made to hypothesize this stat. A survey completed in 2017 highlighted that since the 1960s, alcohol consumption is at its lowest. Another study highlighted that students since 1984 have been consuming less and less alcohol. As this is seen as a major risk factor for Korsakoff's disease, it can be inferred that its prevalence may have followed a similar trend. As a deficiency of thiamine is the main cause of this disease, there are many risk factors that can lead there. As mentioned before, the most common risk factor is chronic alcohol misuse, and it is estimated that 80% of people with an alcohol addiction don't absorb or retain enough thiamine. This is broken down into a multitude of reasons, such as the overall poor nutrition these individuals usually encounter, the ability of alcohol to inhibit the full absorption of the vitamin in food, and its effect on cells, so they struggle in the use of thiamine in cellular functions. Other factors that can cause this deficiency include diseases such as AIDS, bowel or stomach problems, cancer in the advanced stages, where a side effect of chemotherapy can inhibit thiamine absorption, and kidney failure, as long-term dialysis reduces your body's ability to absorb thiamine.
There is still some controversy and confusion around the specific markers of Korsakoff's disease. However, there is a large pool of evidence surrounding the diencephalic hippocampal circuitry as a neuroanatomical marker, which affects anterograde and retrograde episodic memory dysfunction. This circuitry involves the connection of many brain areas, however is the current preferred theory due to its involvement in the anterior thalamus, mammillary bodies, hippocampus, and the mammillothalamic tract. To explain this theory, we look at Aggleton and Brown's 1999 diagram. The shaded areas indicate the hippocampal anterior thalamus axis, where we can see the anterior thalamus receives direct input from the hippocampus via the mammillary bodies and mammillothalamic tract. Disruption to this connection sees a direct association to anterograde episodic memory impairment. The structures in white create a network of connections involving the temporal cortex and frontal cortex. When lesions arise in these regions, there is only a modulatory effect on memory function.
Korsakoff patients have difficulty with declarative memory, with a greater proportional difference in anterograde episodic memory loss over retrograde and semantic memory loss. Hence, patients have a severe inability to remember current and recent events of experiences, but are still able to access earlier memories. This memory inhibition leads to behavioral symptoms of confabulation and significant executive function deficits. The confabulations are characterized by Brown et al. As honest lying, where false memories are created without the intent of deception. Additionally, Altagasen et al. Indicated a clear correlation between executive function impairments and memory deficits, as well as discovering that individuals with Korsakoff disease showed slower and less accurate ongoing task responses than alcoholic controls.
Individuals who have Korsakoff syndrome tend to have different psychology when compared towards unaffected individuals. This includes aggressiveness and uncooperation due to long-term alcohol use, confabulation, confusion, hallucination, and memory loss. In 2020, Auslander reviewed the psychological symptoms and discovered that this can result in individuals neglecting their condition and self-worth and neglecting their families, resulting in negative relationships being formed. Auslander found that these conditions affect the daily life of these individuals, as hallucination make it harder for individuals to decipher what is reality and fiction. Confabulation and memory loss can result in agitation due to forgetting important memories. This can decrease the individual's state of mind and independence, representing the decrease in quality of life. However, the use of psychological therapy can help that affected individual understand the issues surrounding their condition and ways to combat their symptoms. This can result in improvements of self-worth. Roberts in 2022 found through a systematic review that counselling had a positive outcome on improving quality of life and dependency when they used memory aids including reminders and homework to help individuals retain the key points from their counselling.
Korsakoff syndrome affects a range of physical impairments including issues with balance, coordination, and weakness. Clinical symptoms of muscle aches and pains can be observed in KS patients. Murray 2018 portrays the relationship between thiamine deficiency neuropathy and muscle weakness as the patient in the case study is presenting with muscle weakness in the lower limbs, and after treatment of thiamine replacement therapy, the clinical symptoms had significantly improved. Thus, thiamine deficiency can be seen with the association of muscle weakness and myalgia. A case study of a 48-year-old male shows a positive relationship with the intervention of intense physical rehabilitation, which can be seen through the improvement of the participant's activity limitations. Physiotherapists incorporate a balanced system of task-specific movements, enhancing kinesthetic abilities, and may have provided compensation for the impaired proprioceptive reflex mechanisms. Therefore, intervention of physical and cognitive rehabilitation and a tailored approach would be beneficial in the management of a patient with KS, as physiotherapists can help combat and improve symptoms of muscle weakness, balance, and coordination.